Hello, everyone. Welcome to Inside Girl Shield, where we have conversations to inspire young people, educate them, as well as help them plan their lives. Today, we have with us a special guest who is here to discuss a very important topic with us, and I would like him to introduce himself.
Thank you very much. My name is Dr. Amponsa from the Whole Teaching Hospital. Currently doing my housemanship first year.
Okay.
Yes, please.
You are welcome, Doc.
Thank you very much.
As part of activities marking the Men's Mental Health Awareness Month, we decided to have a discussion on men's mental health and emotional well-being.
Wow, that's nice.
Okay. So you are Dr. Hubert to help us understand more about men's mental health today. Before we begin, you've already told us that you are in the health sector.
Yes,
You are
please.
doing your
Housemanship.
housemanship.
Yes, please.
Okay. Why do you think that a men's mental health is very important and worthy of discussion?
Okay, I think it is very important because first and foremost, man is also a human being just like a woman. However, anytime it comes to matters of emotion, society places a lot of importance to that of women, neglecting that of men. In a developing society, I think it is fair and right that we seem to be equally like concerned about that mental health of men, just as we care about women.
Okay.
Because in the end, statistics even prove that that of men is causing more harm than that of the women.
I seriously agree with you. So, how would you explain mental health to the young person to understand?
Okay, so if I'm supposed to explain mental health to a young person or even to a lay person, my best of words would be things happening in the mind of somebody that you may not necessarily see what the problem is. However, sometimes that just sometimes the way they act or behave will make you think something is wrong. And
Okay.
that is just sometimes. In certain instances, nothing is going to tell you this person has a problem
Okay.
unless the person comes out to come and tell you. So then again, I feel like it is more important because it's not like the normal malaria, like gastritis, any other thing that you see, oh, someone has this, oh, then let me help. Do you understand? No, mental health is a bit different.
Okay.
I may be having this, but it may not be what you are thinking.
Okay. So, in your line of work, what challenges does men mental health poses to them?
Okay, so the challenges are actually a lot. However, if you want to streamline based on the purpose of our conversation, realize that first and foremost, men are always trained traditionally to more or less like not bring their emotions out. That's kind of saying Bema and soon. It's a bit more rampant now. So, in situations where a man is facing a problem, just like that of a woman, a man is always trained to keep the problem to him or herself.
Yeah.
That's a very major challenge. And then it's causing more harm than good.
Okay. So, in a way, we say, "Inchume you, men don't cry," and so many men have internalized their problems.
Exactly.
Okay. So, does it affect their physical health as well?
Yes, it does. It really does. If it comes to something we call health seeking behaviors, realize that most men mostly do not like coming to the hospital for, let's say, checkups or for certain symptoms. I've been in the obs and gynae department seeing more women.
Okay.
Realize that you get a lot of females coming to the hospital for not to say trivial issues, but definitely trivial issues. Any small thing worrying a girl or a female, she may want to come to the hospital. I come to realize that if these same things were to be happening in men, men will never bother.
Okay.
The farthest they would go is to like go to a pharmacy, can I get medication for this? And then that's all.
Okay.
They would never bother themselves to come to the hospital if the situation is not so severe that they may think will cause them to die.
Okay.
Yeah.
So now that in our part of the world, our young men are being trained to show strength
Yes.
by not expressing their emotions. Now, and you've said that some of these things have led to the problems they have and even affect their physique.
Yes.
What how does this thing, because till today we are still putting it inside of them, be strong, don't cry.
Yeah.
How does this thing go to affect their mental health?
Yeah. So this is very classical in the sense that it has a very direct link. If society is allowing men to keep their problems to themselves, they should understand that even in the side of health, things don't just happen like they are happening.
Okay.
Like, let's say you have this symptom and then tomorrow it's progressing. So it's like bit by bit. Do you understand? So even if somebody has like hypertension right now, high BP, it starts with the, then some years after complications start setting in. Do you
Yeah.
get it? So because men are learning that behavior of not reaching out to people, not seeking for help and everything, if they have start experiencing anything, let's see, all of a sudden they are sad, all of a sudden they look depressed, all of a sudden this is happening. The fact that they cannot approach somebody for it means that it's going to pile up. Things are going to get severe. Things are going to get worse.
Yeah.
Then suicidal ideations come into being.
Okay.
Then they start committing suicide. Drug abuse come into being. They start being dependent on drugs and many more.
Yeah. This is opening my mind to a number of situations that we find our young men in. You see, even in our school systems, we see a lot of the young men being exposed to issues of drugs, even suicidal ideation that you have mentioned. So this could be part of it because they are not able to bring out their feelings and all of that.
Exactly.
Okay. So what dangers can arise when emotional struggles are ignored?
So the dangers, I think I've already mentioned some in my previous submissions. The dangers are: one, suicidal ideations;
Okay.
two, depression.
If excuse me, if you can explain the suicidal ideation.
Okay. So suicidal
us.
ideations, as the word insinuates, you having the idea of committing suicide. It just doesn't happen like that.
Okay.
There's a whole science, whole physiology behind that, but let's not go into that. Let's talk about the surface level. I am saying this because, let's say, if we say depression is mostly not what we even see. Like, let's say today somebody is sad and we say that's depression. No, that's actually not. But then you are allowed to say, oh, this person look depressed. Like, the person looks it. It doesn't mean the person has depression. When it comes to diagnosing someone of depression, we have criteria. We have some number of months before we can say the person has it. Do you get it?
Yeah.
But then the symptoms start one by one, kind of. Do you get it? It could be that today someone is sad. Then tomorrow, he or she does not have interest in the activities they used to have previously.
Okay.
The next, they realize that situations where this person is supposed to be calm around, he looks so agitated around it.
Okay.
And then it's coming one by one. Do you get it? This person is not getting help. Instead of this man to reach out to a friend or a counselor, the man will say no. Even the friends will laugh at you. When are you this small problem, you're going to tell a counselor. This small problem, you're telling the teacher, are you a girl? That kind of thing. Do you understand?
Yeah,
so the normal man will keep the problem to himself. Things get worse and they don't even realize it's getting worse. Do you understand?
Yeah.
Then time happens and then the worst happens. The worst happening is they now considering, should I kill myself? That is suicidal ideation bit. Do you understand? It gets to a situation where instead of reaching out to better people like a counselor, like a teacher, like their parents, they end up reaching out to just their mere friends because they will not laugh at them.
Okay.
Do you understand? They know the right people to talk to, but they will not. So they will just be there and just think about what next can I do. Then what comes to their mind is, Charlie, I even heard if you take in weed, I'll be fine.
Yeah.
If I start drinking, I'll be fine. I'm not even thinking about my problem. And that's what they consider.
Yeah.
When they do that for a long time, their body now gets adapted to liking alcohol or cigarettes and more. They get dependent on it. It gets to a point where if they stop it, they are getting withdrawal symptoms. So they can't stop. So they become addicted to it. And it goes on just like that. And the worst happens. They may even die.
Yeah.
Do you get it? Yeah. So there's more to it. The problems are actually very serious. However, it's more or less like something in the mind. So you don't see when it's progressing. You can't really identify it started from this time, it ended this time. Unless the person himself is actually trying to give you detailed account of whatever or however the situation has been. Other than that, you are really not going to identify when it started, how it got here, what happened, what he did, or whatsoever.
Oh, wow. So what you said, it's hard to identify. I was about to ask you what signs. Now this is serious.
Yes.
So are there certain signs I can see in my younger brother or a young man around me that no, all is not going on well? Are there some signs,
Yes.
no matter how subtle they may
Absolutely,
be?
yeah.
Can
So
you?
just as I was saying, it may start as small as he looks sad, and it's not just one day.
Okay.
It's going on and on. First, it could be just like that.
Okay.
Secondly, it could be something you call anhedonia. We see this. The meaning is like you have interest in, let's say, football activities.
Yeah.
But then you realize that for this your younger brother, all of a sudden his friends are going to play. He's not playing anymore.
Okay.
Do you get it?
Yeah.
You also realize that normally, if maybe people are playing with Kofi, Kofi normally doesn't get angry. But of late, things are beginning to change. Tables are turning. Now, small thing gets him angered. Do you get it?
Irritated.
Yeah, irritated. It could get to a point where his sleep cycle even changes. It could be that now Kofi is sleeping more than usual.
Okay.
To a normal person, you may think he's lazy. It's just not like that. Do you understand? It goes beyond that. It could also be the other way around. Kofi is not able to sleep well. Okay. You may be thinking, oh, he's just learning, or because Wasi is coming, or whatsoever. But then there'll be more to it. Do you get it? So the symptoms are actually not so extra. They are the basic things that happen around people. Do you get it? So it needs someone who understands psychology, like the study of the mind, to be able to identify that yes, this is a problem. Because it is not normal that somebody has just it's persisting for like 3 to 6 months. It's just not normal. Do you get it? So anytime they come to the hospital, we try our possible best to get to know whatever that has been the problem. So sometimes the person himself wouldn't have even realized that he has some of the presentations until the doctor asks the person, have you realized this? Like, yeah, for the past 10 months this, for the past 6 months this. Then now we're able to put everything together and get to a point of diagnosis. Okay. And then realize that, oh, maybe this is major depression, this is bipolar, this is this. Then we start the person on medications. Do you get it? Okay. However, the point of hospital self is even the extreme bit. Yeah. Let's now talk about just the subtle part. Yeah. Situations where things are not so extra. However, it looks like there's a problem. Okay. Do you understand? Yeah. And these are the things that we've discussed. So when you see it, it could just be, because it could be like a problem from, let's say, something he saw, just an accident that he saw, or an accident that he was involved in, and then maybe he doesn't even get anybody to talk to about. Or it could be like, let's say, for these teenage boys around, it could be that maybe he ended up impregnating a girl and he has run away. Now he needs somebody to talk to, somebody to advise. Or he has gone to steal something from a friend and then he doesn't know his way around. He needs somebody to talk to, somebody to advise, somebody to show him the way forward. Okay. And he gets better. So all these things, if men are actually taught to keep their problems, they don't get the chance to express themselves well, like what a normal young lady would do. So they keep like keeping these things inside. Now they have other thought of doing extra things which are bad, and the end is causing more harm than good. Okay. As you made the comparison between what the young women or women normally do, they get somebody to talk to, then I'm tempted to think of, are there avenues for these young men to sometimes vent or people to talk to, and they are not taking advantage of? You know, it is easy for a woman to open up, but it is not easy. If you take our churches, for example, we always have programs for the young ladies. In our schools, we have programs for the young girls, but for the boys, they are left out. Yes. So many of these things that you are saying, even until it gets to the point where it gets worse, before somebody will even identify, because sometimes they themselves may know, they know they have problems, but they don't know exactly what is causing their problems. So at what point do you think the young man should call for help? Yes. So first and foremost, realize that the problem we are facing in regards to men's mental health is beyond individual problems. Okay. It's not just a problem of men. Do you understand? It goes beyond that, getting to the point of a society willing and readily available to support men in such situations as
Thank
well,
you.
which we can't actually say yes, society is clearly not ready.
No, not yet.
However, there is something we should do. The first thing is every man should come to the point of understanding that seeking help is not a sign of weakness. Rather, it is a sign of strength. It is you proving to society that indeed you see yourself as a normal human being who may at any point in time need help. So I'm reaching out at this point in my life because I think I am not normal and I need help.
Okay.
That is the point. If we come to that realization, it is going to go a long way to cause most males to now reach out for help. Because right now, the ideology is seeking for help is weakness.
Yeah.
Do you get it?
I agree.
If I reach out to my counselor right now, hey, Charlie, now you, I thought you were some boss, I thought you were some Odugo, I thought you were like, so why are you now going to tell her about this small problem? Or something that happened to Kofi that he handled it himself and now he's better. Do you understand?
Yeah.
A lot of men now bragging the fact that, oh, this happened to me, I solved it on my own. Do you get it? That is one major challenge that we should look at. However, society needs to do a lot of work. Society needs to now make sure there are avenues. So it means that even right from schools, JHS, like SHS, there should be people that they are known to handle issues of that sort.
Okay.
Believe you me, I don't know if there is some sort of office of that sort here, but even in UHAS like this, we had psychology lectures. However, we didn't have a sure unit,
Yeah.
like psychology and counseling unit, until like few years ago, like just last year or last 2 years.
Okay.
Do you understand? Even
Yeah.
though the school has been in existence for the past 13, like 12 to 13 years.
Okay.
So that should tell you that it means that it is a problem. And UHAS is even a health school.
Yeah.
Do you get it? So now let's cast our mind back to other schools that are not really developed and things. It means that people don't even have the chance. And the women are having the extra chance because they are women. Naturally, their male lecturers would like them. Do you understand? It is easy for them to reach out to them, say, all of a sudden I feel sad, say all of a sudden this.
Yeah.
But for a male,
What a meal.
on a normal day, train, like they are just waiting for you to just get off, like that kind of. It's not now that somebody's going to get time to you. Oh, Michael, come and talk to me. It barely happens. It barely happens.
Yeah.
So society should make sure that they are putting structures in place, making it easier for all of them, not always putting the females on the advantage side.
Yeah. I know that generally to men or our young boys, when they have this kind of problem, they can present themselves very fine.
Yes,
Our young ladies here, when they are sad, they will show it.
exactly.
They will show it. But for the boys, they always put up this fine boy face, you know,
Exactly.
to show that nothing is happening to them, and it also makes it difficult to identify our young boys. Okay, what are some of the healthy ways for young men to manage their emotional stresses or challenges?
Okay. Thank you so much for this question. I think a lot of people should get to understand this and get to understand it well. When any young man feels like he's undergoing any form of emotional challenges that he himself feels like is not right, is a bit abnormal. First and foremost, I will not even advise to go for counseling or something. It should start from the little things.
Okay.
Try and engage yourself in one things you like, things that you think are productive enough for you. Consider something like exercise, like jogging, that kind of thing. Even if you're a Christian, the best thing to do is even to go back to your scriptures to talk to God about this kind of. However, I realize that anytime you want to talk about mental health, we seem to forget these basic things and then we jump to the counseling bit. Meanwhile, we are in Ghana and you and I can count the number of counselors
we have.
Like, you understand? So if you always preach about seek for help, go to a counselor, it's not realistic. Do you understand what I'm saying?
Yeah.
So I believe we should start from the very little things. Because I know myself so well, you know yourself so well. You know the things that if you are to do on a normal day, it gets better for you. Do you understand?
Okay.
If you try all these things that I'm saying and they are not working for you, then it means that this is a bit serious. So let me now, do you get it? And then going for help is not always a counselor. Just someone who is more or less like a step ahead of you. Someone you believe may have an upper hand over whatever situation you are facing
Yes, sir.
currently.
Yeah.
Sometimes our parents are always not the right people because some of our parents, especially Ghanaian parents, are a bit more judgmental. They are not willing to accept the fact that my boy is an adolescent now, so he's exposed to certain things and they
Yeah.
can happen to him. Do you understand? So I would always want people to reach out to, let's say, their teachers, let's say their pastors, elders. They would find better way to communicate to them, even better than their parents.
Okay.
However, other people are lucky to have parents who understand this and
These
they can
things.
reach out to them. Do you get it? Before even the counseling thing or the counselor thing comes into being. Do you get it?
Yeah.
So the ways to handle this are a lot. As I said, right from you doing the basic exercises. Because sometimes if you are there, you feel like, no, you are not fine. Decide that, no, I'm going for a walk. Do you understand? Decide that, okay, I'm going to the gym just to engage myself physically to see
Yeah.
if I'll get better. Do you understand? Go back to that nice storybook you were reading the last time to see if things are going to ignite better for you. Do you get it?
Yeah.
Before now, you think of other more or less like advanced options to consider. So let's always start from the roots before we go to the top.
Okay. So once we are talking about this, I think that this time Ghana Education Service, for one, is putting in a lot of efforts. And so when you come to our secondary schools, there is a lot of pressure to get counselors for this kind. So for a school like this, we have 4 counselors right now with
nice.
very nice counseling officers.
That's nice.
So now the awareness only have to go down to our young ones that seeking help is not a weakness. It's rather a strength. Strength. Okay. So you mentioned that society is not ready for this kind of conversation.
Yes.
Okay. So when you mention mental health, it connotes should I use the word madness? Yeah, some extreme disturbed mind. You know, when people are really having mental health challenges, we are not able to identify, as a people, we are not able to identify our feelings and our thinking patterns, which especially how our thinking patterns affect our feelings and then our behavior. So there is a lot more the society can do to educate all of us, not only the men involved, all of us, that this, when you do this, is going to affect you in this manner. You mentioned earlier that some people would indulge in drugs, and that drug will rather lead to addiction and then a dip. A dip in your mental health. So there is the need for a certain level of awareness. So what role should the house, the school, our churches, what role should they play in this, should I call it a fight, in this mental health awareness? What role should these agencies play?
Okay, thank you very much. For the role the agencies are supposed to play, there are actually a lot. However, let's take it bit by bit.
Okay.
First and foremost, before even these agencies come out, we should be able to equip them with the good information. Because in as much as we believe people may know, not everybody understands the details of mental health.
Yeah.
Even when it comes to, like, we doctors around, we have people who specialize in psychiatry, psychology.
Okay.
And they are more or less like the better and the best people to give us the knowledge about mental health. However, they are not enough. So it means that the dissemination should come down a bit to all and sundry for us to be able to now distribute to, like, the people we need to distribute the information to.
Okay.
So it should start from one. Society trying to make sure that the best of people with the knowledge give better information to the agencies before they go out.
Okay.
And I'm saying this because a number of times we have people on the radio station saying a lot of things which are not right.
Exactly.
So in as much as the radio station is going so out there, making a lot of people hear it, because it's like every local place there's a radio station information center. If these people are not giving us the best information, then what's the use? They mean that every effort you are putting into trying to work around mental health is actually going to fail, because you are not getting the best information on the ground. Do you understand? Then again, still around the information, the kind of information we are giving out there, we should make people understand that someone being mad is actually not always something spiritual or religious. Do you understand?
Yeah.
We should make people come to the point of realization that it started or it could start as something small. Something small like someone feeling sad all of a sudden, someone acting a bit strange all of a sudden, and then we not paying attention to, and then it gets to this point. I don't know if you realize, but you and I know that the number of mad men are more than mad women. Do you understand? Does it mean that it's only the men that, let's say, they are spiritually being attacked or something? Do you get it? That should tell you that in neglecting mental health, it goes a long way of we seeing a lot of mad men than women. Then again, statistics will prove to you that when it comes to suicidal rates, it is more in men than in women, which means that clearly, as you are neglecting the mental health of a man, it goes a long way of putting them at risk of suicidal ideations. Do you get it? When you really sit down to analyze, you realize that everybody has a role to play. And even with someone who is a victim of any mental health condition or having any challenges, you realize that mostly society has this kind of stigma that is preventing them from reaching out.
Yeah.
Do you understand? If your own son even comes to you to come and tell you that right now maybe I feel sexually attracted to my male friend, you even slap your boy. Do you understand? You do, like, the way you act will not be nice. I'm not saying you should be happy to receive such an information, but it should come to a point where we have better ways of handling such situations.
Yeah.
Yes, it is abnormal. Yes, it is not right. But how do you approach it? If your son knows very well you are not going to approach him like nicely when he comes to tell you this thing, he wouldn't come and tell you. Do you understand? He may end up sharing this information with people who may even tell him, Charlie, I don't think it's so bad, though. You can continue. Do you understand?
Yeah.
It may even cause him to now look for material that supports what he's doing, and you continue doing. And you come back and say that maybe some evil spirit is doing your son or something. Do you understand? There is a lot of people are supposed to know about mental health. So even because of that, then when you come to any psychology, psychiatry class, one of the first rules is there's nothing like a madman or a mad woman. Do you understand?
Yeah.
The best you can go is maybe this person is mentally ill,
Yeah.
but the person is not
Not
mad.
mad.
Do you get it? Because if you come down to the physiology of it, it's just more or less like hormones being imbalanced in his brain, neurotransmitters being imbalanced in his brain. That's causing him, which means that technically this thing can happen to you, can happen to me.
Anybody.
We are not so different. So I mostly tell people that we are just lucky we are not like them. Do you understand? Because come to think of it, somebody can just lose their relatives today, and maybe as soon as you hear the news,
It triggers.
do you understand? It just happens. It just happens, and it is so because sometimes society feels like, oh, but people have lost their wives, people have lost their mothers. Why are you taking this so serious? Do you get it? So it means that we should find a way to be able to make sure that anytime there is a problem and people are approaching us, we have better ways to solve and handle their situations. This will go a long way to help us achieve what we are trying to achieve.
Okay.
Another thing I want us to consider is the prioritization bit.
Okay.
See the way we tackle breast cancer awareness. See the way we tackle it. Everybody's wearing pink. People in organizations are putting the pink tag on their shirts everywhere.
Okay.
There are series of events, series of podcasts, series of seminars, webinars all about breast cancer in October. But when it comes to June, just some few people really take this mental health serious. And even when it comes to the men's side, oh Jesus.
Is it that the men themselves, when it comes to these things, you see the women championing it a lot.
Okay, yes.
Yeah. You see the women championing some of these things. Things stuff like breast cancer awareness month, October, Mother's Day and stuff. Women championing it. But when it comes to issues of men, you don't see the men coming out. It's still part of the conservative way or conservative nature of men.
I get it too. Let me not even cut you short. The point is, the problem, just as I said earlier, is not only more of like individual problem, like problem of the men. But let's say if you are all working today and you are working with both males and females, and then a female comes to tell you that today I feel so stressed, I'm not sure I'll be able to come to work tomorrow or something. It sounds a bit okay. Imagine a man coming to tell you the same
He's
story.
lazy.
Exactly.
He's trying to be
Like,
lazy.
do you understand?
Yeah.
So it means that even if a man is sick and it's not so severe to put him down in bed, he still has no other option than to force and show up.
And show up.
But for a woman, he knows that if he actually chips in something small, tell you something small, you understand and you believe. Do you get it?
Yeah.
So since society has already placed this notion in the minds of men that you are strong, you are forever strong, you always have to show up every single day of your life. It means that moments where they are not feeling for it, they have to show up. And sometimes that could be the point where they are even dying out and you not realize.
Yeah.
Because stress or burnout is also something that we really need to talk about, especially in the aspect of the mental health with regards to health workers. Do you understand? Especially with junior doctors who work for like extra hours and very long hours. We are not paying so much attention to it because we feel like they sacrificing so much is saving life. But we've forgotten that they also have their own life to take care of.
protect.
Do you understand? So even when you come to the medical practice, you see how you and a woman will be doing the same thing. But a woman can get tired and go and sit or go and sleep small. But for a man, you can't. Do you understand? Unless the situation is so calm that now everybody is resting. Do you get it? So it means that society itself is not really willing to allow men to be on the same pedestal as women when it comes to issues of emotions.
Okay.
Do you get it? And it's going a long way to affect them in the end.
Okay. I agree with you. Now you mentioned, can we go?
Okay, I will
Yeah.
start now.
Okay, so finally, the stigma, misconceptions, and myths surrounding mental health. You know, somebody will say, "Oh, you can't really treat mental illness completely. Oh, there will be some small left." You understand? So all of these ones come to prevent people from seeking help, especially men from seeking help. And it's a myth.
Yes.
It's a myth, right? From the doctor's perspective.
Yes, it is.
Is there a point where people can get treated, people can get therapy, and they are okay?
You see, so the point is, you can't say a definite yes or no for this because nobody can actually put somebody down and say you are fine. Do you understand? Sometimes the only difference between I am fine and I am not fine is because I have not come to the hospital for you to assess me properly.
Okay.
Do you understand? However, we have seen situations of people who were not more or less like depressed and now they are better. Do you understand? So society cannot be sitting down and telling us that people cannot be completely well. People can be completely well, just that there is no better yardstick to measure who is 100% fine and who is not fine. Do you understand? Even though there are few situations where people may have relapse of their symptoms, even after a long way of therapy or medication, it can happen. But it doesn't mean we shouldn't focus on getting therapy or getting medication for whatever situation you are facing.
Okay. So, Doc, I would like you to just give us some quick coping strategies and support as we wrap up.
Okay, so for the coping strategy, just like we discussed earlier in my submissions, first and foremost, identify yourself. Get to know yourself well and get to know when things are going wrong in your life. That's the best way to measure it. Do you understand? Because nobody will actually be able to identify which is so normal for you and which is so abnormal for you. You yourself will be able to identify it. Secondly, anytime you are feeling emotionally down, there are a number of things that you should do. First, try and consider things that already make you happy. Try to do them and see what's going to happen.
Okay.
Try and indulge yourself in, let's say, going for walks or going for a stroll, either alone or with maybe a very good friend that you know you can talk to. Do you understand?
Yeah.
Then again, if you are a Christian or a Muslim or someone religious, go back to your scriptures and talk to your maker to see if things are going to work well around you in that regard. Because it's not always about something just physical. Sometimes it could be something a bit more spiritual bothering you, and then you need God to actually help you clear your mind.
Okay.
That is also there. Do you understand? Yes, but we don't have so much time to decipher between which is this and which is that. But that's also something that we should consider.
Okay.
Then again, too, feel free to reach out to someone who has a bit of an upper hand than you, and then discuss such issues with. Before later, you advance in going to your elder, your pastor, or your counselor.
Okay.
So the coping strategies are a lot, but then they are not cast in stone like that. It depends on what the problem is. Do you get it? So it should tell you that if it is starting small, get to know it yourself first,
Okay.
and then try and see if it's going to get better. If after a few days you realize that no, this thing is persistent, and then you can decide to, oh, I'm reaching out to a friend, I'm talking to a friend about it. Or if it looks like more of like a serious health issues, no, I'm going to the hospital. Do you get it?
Yeah.
So it means that we doctors, we the medical team, also have something to do to society to let them know what warrants someone coming to the hospital.
Okay.
Because it cannot happen that, let's say you are here today, maybe someone dies, and then tomorrow you are coming to the hospital. My friend died yesterday, and I'm sad, and I'm so sad. You see, it doesn't really make sense. Do you know? However, there could be situations where the death could have been as back as 3 years, 2 years ago. But it looks like since that, the things in your life have changed.
Okay.
It becomes a bit abnormal, and it looks like you need help for that. Do you understand? Because coping strategies are different.
Yeah.
How I'll handle some information, the same information right now, will be different from how you handle yours.
Yeah.
It means that different people need different mechanisms to cope. Do
Okay.
you get it? So society should allow people to adapt to any kind of coping strategy that they want to.
That's
And society should be trained and educated so much that they are also aware that people trying to seek help, especially men, is not a sign of weakness. Rather, it is their proving strength that indeed they are humans and they need help as well.
Thank you for that one. That message, the last part of the message is to all of us that when men seek help for their mental health, we should understand that it is not a sign of weakness, but it is a strength.
Exactly.
We all need to come on board to support our men. In this month of June, we are campaigning for men's mental health. On that note, I want to especially thank you, Dr. Hilbert Amponsah, for sharing this wonderful insight to us this afternoon. Thank you.
Yeah, welcome.
And have a nice day, everybody.
Yes. Bye-bye.